It is that time of the show when we say hello to today's guest, and we are joined by a man who is no stranger to Ron Stark, the voice. Chuck Kiskaden, who is president of Health Benefits Advisors. And Chuck, over the last, couple of years, you've been coming on fairly regularly, pre-Affordable Care Act,
yes.
Pre-Obamacare, and then just as it was rolling out, and now post-rollout, and you've been kind of guiding us and directing us and educating us. All I want to ask now is, so if you like your doctor, you like your hospital, you can keep them. Yet over 1 million cancellations have gone out. What's happening here?
First of all, thanks for inviting me back, Ron. It's really wonderful to be back. What's happening? Gosh, when the law was put together and they decided that they were going to have this new minimum level of coverage and carriers couldn't offer benefits below that new minimum level, it just happens that there's about 1 million people whose benefit program, for whatever reason, they bought a program that didn't include maternity, or they bought a program where drugs wasn't included to the level that it should be, or some other thing. Had some sort of a limit on lifetime coverage or something. As a result, there's about 1 million plans that individuals primarily had purchased that didn't meet this new minimum standard because it fit their lifestyle, but it doesn't meet the new law.
But my question is, and I know you can't speak for our government, obviously, but you can maybe give us some guesses, is before I, as a president running for re-election, is going to make a statement like that, wouldn't I have gone to someone on my team and said, that's true, isn't it?
I suspect that, no, I don't think so. He probably would have gone to his team and said, what can I say that generally covers the law? And for the most part, he may have even expected that you could keep your same doctor and possibly keep your same plan, because at the group level, there was the option for a group through what was called grandfathering to keep their group plan. Mm-hmm. And he didn't anticipate individuals with individual plans. So I suspect that it was an oversight, but it certainly has burned him. There's no doubt about it. I was thinking as I was driving here, I can just imagine that Obama's worst nightmare is waking up, and he's on this island, and there's all kinds of beautiful toys around him, and that's what this looked like. And now he finds out he's on the island of misfit toys, and that's his life right now.
Right. Well, I mean, this goes back to Bush's "Read My Lips." I mean, to me, it's at that same level, because there are those in the press or media making the accusation that he did know and he purposely misled, because this was his vehicle of choice to win re-election.
And that's possible, but I doubt it, quite frankly. I mean, as an expert in this area, none of us anticipated that this many people would have plans canceled because they didn't meet these new minimum levels. I mean, I knew people that bought programs without maternity, et cetera, but I had no idea of the size of it.
We'll give them a possible pass.
I'd give them a possible pass. I wouldn't give it
that one.
False.
But the launch of the website and all of the other challenges that this program, there are some states that have had enough online signups that you could count on both hands, and some, I believe Oregon, that still had none.
That is correct.
And I know early on, I guess it's improved, but early on I signed up through Covered California when they were having massive problems with their site, and it took me almost 3 hours of getting bumped and going back in before I finally completed it. So what's going on? Is it unraveling? You know, what are we just, at least for now, going to have to just make the best of it?
The latter, I think, make the best of it. I do not believe it's unraveling. I think it's actually improving. The latest numbers are Covered California has about 60 or 70,000 people Medi-Cal related signups and another 60 or 70,000 regular signups. So they're doing quite well. The government site has now enrolling people, and the latest thing I had heard was that some people, their navigators enrolling people, give it an 8 or a 9 out of 10. So it's working well, other than the fact that it doesn't enroll groups yet. The groups have to go directly to the plans. So I think they've done some cosmetic improvements that make people, you're capable to sign up right now. Is it going to unravel? I don't think so. I think they've done enough of this cosmetic stuff that's going to be pushed aside. And now if it unravels, it'll be because of cost, and people get in there and they find out really what they expected is much more expensive than they thought.
Right, and I want to talk about that in detail in a little bit. You know, one of the things that we hear time and again, even from people in Obama's camp and from the the Affordable Care Act kind of group, is that just wait. Once we get past this hiccup, this road bump, everyone's going to love what they have. What do you think?
I do not. I think that there's some serious road bumps down the road, even at the group level, because
and this hasn't rolled out to businesses yet.
it has rolled out to businesses. 95% of small employers in California, for example, have been re-enrolled early so that they don't have to be subject to the rating changes that we talked about in previous discussions. If you could change all your and re-enroll for December, so a lot of them did. But when they get to their renewal next year, they're going to be subject to major increases, as much as 10% just because of a change in rating practices. If you've got a lot of younger employees, you're going to get a major hit. I think that there's going to be a significant surprise over the next year or so as employers finally see what's going to cost to be part of this.
And my understanding is a lot of employers are just going to stop offering benefits and just drive their employees into the
exchange?
The exchanges.
Well, there's an advantage to doing that, because if that employer continues to offer benefits, the employee cannot go to the exchange and get a subsidy, nor can their dependents go to the exchange and get a subsidy as long as that employer is offering benefits. So if you've got a lot of low-wage employees, it might make sense to do that. There's some serious problems with not offering benefits. Suddenly you're giving your employees perhaps some money, and that's compensation, which is taxable. That money is now going to increase your workers' comp cost, because that goes into the calculation for workers' comp. You've got uninsured employees that may have major problems and no insurance. There's a lot of negative things with doing that.
Okay.
And very few employers have made that decision that I've seen so far.
But they're thinking about it. Now, when we when we come back, I want to talk more about the impact to employers and the actual cost and the long-term impact to us as consumers.
Okay.
So the best part of this conversation is yet to come. Don't go away. You are watching or listening to Ron Stark, the Voice, coming to you from the wonderful KGEM studios in beautiful Old Town Monrovia. And our guest is a returning friend to the show. We are joined by Chuck Kiskaden, who is the president of Health Benefits Advisors. And Chuck, in the first segment, we were talking about this seeming debacle called the Affordable Care Act. And one of the things that I think people are starting to see is that the plans they're getting in many cases offer less and cost more. And one of the core concepts of this plan was that it was going to be self-funding. And it was going to require a lot of younger people to get involved to offset some of the costs for those coming into the plan that have pre-existing conditions, et cetera. And we're not seeing a lot of young people signing up. Is that right?
Not yet. I think that the young people, in order to get encouraged to sign up, there needs to be either awareness, and I heard this morning that at least 50% of the people still don't know what is involved and what the jeopardies are if they don't sign up. And there has to be some sort of a penalty if you don't do it. And right now the penalty is only $95 or 1% of your income. And if you're making $30,000, that's $300. Mm-hmm. You know, okay? Or excuse me, $3,000. Yeah, $3,000. 1% with $300. Excuse me.
Yeah.
Yes, right.
And I know actually several people that are low income by choice. You know, just them taking care of themselves, and they've already made the decision. They're just going to take the penalty. They're just going to take the hit.
Well, unfortunately, there's more to it than just taking the hit, because if you've got a family of 3 or 4, the penalty is per person, because everybody's supposed to have insurance. And that penalty in a couple of years goes up to 2.5% of income, or around $600 or $700.
Well, and
it still may make sense to pay.
I see most families, you know, I mean, if they're wise, doing something. But a lot of these young single people, my concern is a lot of them are just going to take a pass on this, and that could affect the whole financial balance of the program.
It absolutely will, because as we've talked about before, there's an actuarial expectation that they'll have enough healthy people to offset some of the cost of the folks that need health care. And if they don't get that blend to spread the risk, then this thing could financially blow up within 3 years, 4 years, because it'll take that long before the carriers realize that they're not getting enough healthy people to make their rates work.
Right.
And if they keep taking the rates up, eventually people are saying, well, let me out of here, I can't afford it.
So, what's it going to take? I think everyone agrees it's broken. Some feel it should just be tossed away completely. I think the majority of people recognize that's unlikely, next to impossible. But what's it going to take to fix it?
First of all, I'm not sure that it's broken yet. I think it certainly has had some major bumps in the road. The premise behind, people don't have to worry about getting insurance because of pre-existing conditions. That's good. There's some good parts of the law.
And that you can keep your kids on your insurance
But the financial side
longer.
of it, is it affordable, and will I be able to keep my doctor and all that stuff? That stuff's being exposed, and certainly that part's broken. What's it going to take to fix it? Time right now is the only thing that's there. There's not any major push to make changes right now that's going to be politically acceptable. So until there's enough political pressure, pushback from people saying it's too expensive, it's not working, whatever, when that starts happening and the Democrats respond as well as the conservatives, then you've got the pressure to do it. But until that happens, no change.
Well, and that's already starting. A lot of Dems, especially those that are up for re-election at the midterm, are starting to put their re-election ahead of party. And we're starting to see more and more of them make that switch. And, the big question is what happens in the midterms if the Republicans, who already have the House, get the Senate?
Well, they would have to get the presidency too. So midterms won't make a change.
Okay.
So even if they had the House and the Senate, the Republicans are starting to do some things that are pretty smart. They're taking the budget issue off the table. There were some discussions today about coming up with a budget resolution because they really got burned, as everyone knows, about 6 months ago. Well, this has certainly turned that around, and they need to ride that, so they need to make sure nothing else comes up to change that momentum. So I suspect that until the next presidency, which is over 2-3 years out, we're not going to have any change in this law.
Well, and interestingly, because you mentioned if this is going to really start breaking down, at least financially, that's 2 to 3 years off. So about the time of the presidential election, there could be tremendous electorate pushback on this.
Absolutely. Would not surprise me at all.
And that could really turn the tide on the whether our next president's Democrat or Republican.
It easily could turn the tide. That's right.
But for now, for anyone listening in and going, okay, but Chuck, so what do I do now? Recommendation.
Get
Visit the exchange?
No, I wouldn't say the exchange is the option because you can get the same benefits from not going to the exchange, just from the carriers. But if you want to have the subsidies, then you have to go to the exchange. Take advantage of it. They're there. They're going to help people afford insurance. It's certainly there. If they buy the silver level plan, they actually can improve their benefits in the silver level plan. So I'd say now take advantage of it while it's there, and then we'll see what happens 2 or 3 years down the road.
And what's kind of the cutoff point for getting those subsidies in terms of income?
For a single person, it starts around $45,000, $46,000.
So if you're making less than that and you don't go to the exchange, you're being kind of silly because you're going to get some of your costs underwritten.
Absolutely. You're losing out on an opportunity. And if you have a family of 4, it's like $92,000. So if your employer is not offering coverage, you absolutely should go to the exchange because the only place you get the subsidies is in covered California.
Okay, so if someone wants more information about anything we've talked about, or especially the families, what might be the best thing for them to do, how would they get a hold of you?
They could contact me, healthbenefitsadvisors.com, or call me at 949-636-3601. But basically, they really need to push their insurance broker, their agent, to make sure they're really keeping up on this.
All right. Thank you for joining us. And sadly, I have no doubt you will be back again before we know it.
I look forward to it.
Thank you, Chuck. Don't go away. We will be right back.